day everyone, my name is Hannah Marpi Komoda and I would like to share to you about the awareness of COVID-19. First, what exactly is a COVID-19? COVID-19 or a coronavirus are large viruses that have a genetic core surrounded by the lipid envelope with a protein spike, giving them the appearance of a crown. Crown in the Latin word is corona, which is how these viruses got their name. Coronaviruses impact both animals and people in various ways. In human, coronaviruses can cause respiratory infection ranging from the common cold to more serious disease. These include the severe acute respiratory syndrome coronavirus, which was the first identified in China in 2003. In Middle East, respiratory syndrome coronavirus, which was identified in Saudi Arabia in 2012. So, where did this brand new infection originate? It is well known that coronaviruses circulate in a variety of animals. However, these viruses can occasionally make the lump from animals to humans. This is known as a spillover, and it can be caused by a variety of factors such as virus mutation or increased human-animal contact. For example, first coughs is known to be transmitted from camels, and the new viruses animals reservoir. Droplets emanated by an infected person through coughing, talking, or sneezing can spread the disease from one person to another. For example, when contaminated droplets land on an object adjacent to another person, they can spread when that person touched them and then touched their eyes, nose, or mouth. What exactly are the signs and symptoms? The incubation period, or the time between being exposed to the virus and developing symptoms, is on average 5 to 6 days, but can be anywhere from 1 to 14 days. Symptoms can range from mild to severe, and some people may not develop any of all. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, shortness of breath. Some people have also reported loss of sense and taste. About 80% of cases recover without having special treatment. Although some people are at higher risk of serious sickness, such as the elderly of those with underlying medical conditions such as chronic respiratory disorders, obesity, diabetes, high blood pressures, heart disease, or cancer. What can we do to keep viruses from spreading? There are a number of effective ways to prevent the spread of the disease, including using a flexed elbow or tissue to cover your mouth and nose when coughing or sneezing, and throwing the tissue in a closed container immediately after use. Washing hands regularly with soap and water, or an alcohol-based hand rub. Keeping at least 1 meter distance from people, and using masks and respiratory appropriately. Settings: if you're feeling unwell, stay at home and call the hotline or your doctor. However, if you have a fever, cough, or difficult breathing, seek medical attention as soon as possible. And tell someone about your travel history or encounter, and do so with your physicians. To prevent the pandemic from spreading further, government in some localities have built special physical and social barriers. It is critical to adhere to the vaccination recommendation in order to avoid complications. That's a quick overview of this emerging infectious disease. We're still learning new things about it every day. So please follow protocol in various locations in order to prevent the COVID-19.